This is a short video about the Tom Brady discussion board. I will try to keep this brief, and again, thank you to everybody who provided a discussion board post. We had some really good postings. First, about being open-minded, that we are challenging common held beliefs in this class. That doesn't mean you have to change your mind. It just means that some of these beliefs certainly exist in society, and we are presenting material that challenges these beliefs, and that's part of our learning process. Many folks still, rightfully so, express concerns about why can't someone just say no and stop using, because their lives are more important than wasting their life. Well, for someone who is not using, that may be true. But imagine that you're using a drug that makes you feel better than anything ever has in your life, times 1,000. That's how it feels for many people the first time they use. And if you've had a lot of pain in your life, or even if you haven't had a lot of pain, but a particular drug helped you escape a certain life circumstance, or you grew up with family members in the neighborhood of individuals who use frequently, and honestly, in the very beginning, drugs is a solution because it takes us out of what we know and out of our pain. But the more we use, and very quickly, this solution becomes the problem. And as this solution becomes the problem, how we see life changes, how our brain chemistry processes information changes, and what is most important to us personally changes. So think of the most important thing to you in your life and having to give that up, even if it's bad for you. Many of us have a really hard time breaking habits, really bad habits. This could be something as simple as drinking soda with a lot of caffeine, or other food, or driving fast, or spending too much money. We slip into old habits over and over and over. And this is what a drug user does, except they not only have that habit, they have the disease of addiction, where the body and the mind has been changed organically. One person asked, is it necessary for someone to leave a neighborhood to stay clean? No, but it's hard to stay in a particular neighborhood or stay with family that constantly and frequently use and find sobriety yourself. This is a great challenge for folks in treatment. On the outpatient setting, if you are attending treatment in the community, you're trying to stay clean, you're going to your meetings and attending counseling, and you're really making efforts to stay clean. But after group, you go back home, and your sister's using, or dad's using, or your husband is using, and it's so hard to go back into that same environment and stay clean. This is a really big challenge, especially with outpatient treatment. When I was actively involved in treatment in the late 90s, we had a significant amount of money to send folks to inpatient treatment for 21 to sometimes 40 days. And my patients would make significant progress staying clean and beginning to evaluate their lives and their choices while in treatment. But they had nowhere else to go except to go back home, which is where many times drug use is encouraged. So this is a major issue for folks trying to stay clean. Some folks talked about pain management. How do you manage pain without drugs? Very good question. There are actually, to be honest, really good pain management techniques out there with medication that's not based on narcotics. Most doctors don't want to use it, to be honest, and it's extremely difficult to match the patient. And in the very beginning, it may not be very effective. Or with some patients, it's not very effective at all. But there are other options out there. There's non-addictive medication that can be used. There's pain management related to exercise and meditation, and yoga, for example. pain clinics, really good pain clinics that are not in the business of passing out narcotic medication to anyone off the street, or really reputable pain clinics, let's put it that way, are really good at managing pain without narcotics. Suboxone, for example, one of those medications that's used to help heroin addicts stay off um, their drug of choice, is actually a really good manager of pain for many patients. I've actually had a dear friend who was a psychologist, who was a heavy drug user in the 70s, who had found sobriety and became a psychologist. Experienced back pain in the late 90s. And he failed to share with his doctors, who was a former addict, although he knew better. And the doctors put him on significant pain medicine that was narcotic based. And he relapsed multiple times, and actually had 2 automobile accidents while driving under the influence of alcohol and using drugs, and is now in a wheelchair. Almost died because he did not disclose to the medical doctors his lifelong addiction, even though he had been clean and sober for over almost 20 years. And this is someone that knew better, academically, professionally, spiritually, and otherwise. He should have disclosed that, because there were other pain medications that could have helped. In his case, he was thinking like a dry drug. He may have been sober from his substances for over 20 years, but negative thinking and addictive thinking had crept into his psyche, which influenced his lack of disclosure about his addiction to his doctors. We talked about spirituality again. That again, spirituality is not mind over matter and has nothing to do with religion unless you make that choice. And this is not about willpower. Allowing spirituality to help you overcome your issues with addiction doesn't mean that in and of itself is the solution. It is a tool. It is a way of controlling your ego over and above anything else. And we'll come back to the spirituality topic in coming weeks, beginning with the Al-Anon information and the information about AA. And I hope many of us will increase our understanding. It's not magic. Drug use is not magic. Getting high is not magic. Trying to find sobriety is not magic. It's tough stuff. It's the most complex, confusing, and fascinating human experience I have ever met. And in all honesty, the strongest people I've ever met have been addicts who have used or who have found sobriety. And that strength can be a great benefit in terms of seeking sobriety, or it can be a great limiting factor as well. Again, these Tom Brady videos are it's my effort of sharing with you one perspective, someone's perspective who had used for many, many years, who was well respected inside the state of North Carolina for years, and in the Southeast, not only in the professional setting, but in the AANA setting. Tom traveled nationally and spoke at meetings, and he's no longer with us now. He passed away many, many years ago. His words still ring true to many people.